Hello and welcome to another webinar here at the DNA Company. We are so happy you have joined us today. We're going to be talking about something a little bit heavy, a little bit challenging, especially for women, and something that I personally have dealt with, and thankfully, something that has become a lot more dove into when it comes to the knowledge behind birth control and genetics and navigating that seemingly, area of not knowing what's going on. So, as I'm sure you have figured out, and by logging in tonight, we are going to be talking about birth control and your DNA, and really talking about the silent threats to your health and how your DNA really works into that and what you can do about it. And I have the great honor of hosting tonight's webinar with a dear colleague and friend, Dr. Steady Hardcastle. Hello, good evening. So good to see you. Just love those pink earphones. It is.
And they go nicely with your shirt.
Oh, well, yes, I guess so. So how are you doing today?
I am well, Dr. Varden. How are you?
I am doing quite well, enjoying the summer weather. I know Dr. Kosterman definitely likes summer weather.
As do I.
She's enjoying the heat. So yeah, this is a topic that many women, think about, go through, struggle with, and may not realize what exactly is going on. And I feel very honored that I get to sit here tonight, stand here tonight discussing this. And I'm going to share some personal things that I went through, wishing that we knew what we know now. So you were going to say something.
Then I started listening to you again and totally lost what I was going to say.
Well, one thing I do ask for our audience, if you could please fill out that poll. We want to know who we're speaking with. What kind of information is important to you on this topic? Where do you fall within this realm of contraception and symptoms? So please, fill out that poll. We will bring that up and talk about it in a few more minutes. But one of the things that I wanted to mention, some kind of scary stats. And it's not that I'm trying to do clickbait or fear mongering, but we have to realize the reality of the situation. And when I was doing some prep for this webinar, I always do some research on some of the latest studies, and I came across one. It's a Danish study that actually, this was just published in the British Medical Journal earlier this year, so just a handful of months ago. And this large scale study involved over 2 million Danish women. And it found that using combined hormonal contraception, so we're talking about pill, vaginal ring, skin patch, okay? All of these things can significantly increase the risk of cardiovascular events. Now, we know cardiovascular events, heart attacks, okay, #1 killer. And for women, unfortunately, their first event is usually their last, because it usually kills them, which is not good. So we want to make sure that we lower that risk. And in this study that they were looking at, this study revealed that the vaginal ring raised the risk of heart attacks by 3.8 times and ischemic stroke by 2.4 times compared to non-users. Similarly, the skin patch was associated with a 3.4-fold increase in stroke risk. Even the commonly used estrogen progestin pill was linked to a doubling of both stroke and heart attack risks. Now, granted, while the absolute risk does remain low, these findings really underscore the importance of personalized contraceptive counseling, especially for women with existing cardiovascular risk factors. And that includes your DNA. And thank goodness we have the technology now, and it is becoming more mainstream that information that is the blueprint of who you are and what you have to work with is now available to you, available to your doctors, available to open up that conversation of going, hey, I want to make sure that I am lowering my risk, still helping with the issues that I'm having for whatever reason you may be on or may want to be on some sort of contraceptive birth control, but that you're not putting yourself at further risk. So I would like, first of all, did you have anything to add to that, Dr. Steady?
Well, I think what I would like to add is that according to a 2022 study, 31% of women using birth control experienced side effects, and 52% of them said that they were worse than they expected. So I think that even though the risks of death may, ultimately be a lot scarier, even just living with side effects can be unpleasant, and dealing with those and seeing what other options there are or what options you can have for making those side effects be decreased is an important thing to think about as well. So even if the most drastic thing doesn't happen, people should have a good quality of life. So I just wanted to put that out there.
Absolutely. And, when we're talking about quality of life, that also works into mental health. A lot of us, we don't realize that contraception, birth control, the direct manipulation of your hormones can affect your mood, can affect your emotional stability, can affect your mental, emotional life. And a lot of times we don't connect the two and realize, that could actually be the cause of why you might be having more mood swings or, having suicidal thoughts. Or, I'm not saying that is the reason, but it should definitely be looked into if you don't have a true cause. So with that, I would love if, Vanny, if you could bring up the poll. And Dr. Steady, would you please do the honor of presenting the poll to our audience, please?
Absolutely. Our first question, are you currently using hormonal birth control, pill, patch, ring, IUD? And about 6%, yes, currently using. 71% no, but I have in the past. And 24% have never used hormonal birth control. Question 2, have you ever experienced unexplained symptoms while on birth control? And this is a check all that apply. So people could fill out more than one. 29% said migraines or severe headaches. 35% said mood swings, anxiety, or depression. 47% said weight gain or bloating. 29% said low libido. 18% said blood clot or clotting issues. 12% other unexplained symptoms, and 35% no, I have not experienced unexplained symptoms. Question 3 was, have you ever had genetic testing done? And 82% yes, comprehensive genetic testing. 0% had ancestry-focused testing only. 6% said no, but I am interested, and 12% no, and I'm not interested. Primary goals for attending this session it seemed mostly to be, I want to learn how genetics impact women's health. 59% responded with that. And other, please add to the chat, was 29%. So hopefully we'll get some good feedback in the chat. And 6% were considering coming off of birth control safely, and 6% were looking for solutions to symptoms they can't explain. And number 5, how confident are you in your current knowledge of how your genetics may impact your reaction to birth control? And 18% said very confident. You must be people who come to a lot of webinars and have looked over your reports very carefully. 35% are somewhat confident, 35% not confident, and 12% said they had no idea this was even a factor. So thank you all for answering our poll questions so that we can better help you today.
And I would encourage you that for those of you who answered other in the question, what is your primary goal for attending this session? Please, we would love to see why in the chat. Type it in, because we do capture that. And I'm also going to read it to make sure that we fulfill your desire of what you are looking for in this webinar. And see, that's the nice thing about live webinars is we can, shift, change course, add on some things as we go. So, because again, you're taking the time out of your day to listen to us. So, of course, we will, give you information that you're looking for, making your time worthwhile spending with us, which we are so grateful for. So thank you very much, Dr. Steady. Really appreciate you, going over the poll. So let's dive in. Let's talk about some of the things that birth control, genetics, how that works into the symptoms, into things that, people had said, what are you dealing with? What have you felt symptomologically when you have taken birth control? And one of the big things that I saw, weight gain, bloating, I saw migraines, seeing, some of these other symptoms, that we had mentioned, in our description. Oh, guys, I want to say thank you. Caught my eye. Information is coming in on what you wanted to learn. I've got Mickey. She is saying, wanting to learn more about how genes impact symptoms and hormonal health in general. Oh, fantastic. You're in the DNA University. Welcome. Thank you so much for being here. And yes, that's exactly what we're going to be going over. Rachel is saying that her 13-year-old daughter, her pediatric rheumatologist and other doctors are recommending she try birth control pills due to very heavy periods and low ferritin levels. But she's not anemic, even though she's got the low ferritin. And she's wondering if birth control, oh wait, I just scrolled here. Wondering if birth control makes other health conditions worse, like POTS, which is postural orthostatic tachycardia, meaning that, when a person changes position, stands up, it makes their heart race. She also has a history of a TBI, traumatic brain injury, and connective tissue disorder. So yeah, she's got a lot going on, and hopefully some of the information that we talk about will help give you some insight on where to look, especially in her DNA, that you can bring to her pediatric rheumatologist or other doctors and have a more informed conversation on how to better support her. Kevin is saying he's a man, just interested in information. Kevin, you are awesome. Thank you so much for being here. We need our men to support us. We need our men to be knowledgeable, to understand what we're going through, because you're the other half of the equation. So thank you so much for being here. Marina is stating that she wants to use this information to help counsel patients about contraception as an OBGYN. Thank you so much for being here. I love when practitioners come in with an open mind to learn more, to understand and start implementing different tools like knowing someone's DNA into their own practice. So absolutely. And if you have some nerdy questions you want to ask away. We will be happy to answer those too. So I appreciate that. And if you have specific questions as we are going, please put them in the Q&A, and we will make sure to get to those as we're going, and we'll probably answer some as we go along anyway. So one of the things that I wanted to comment on, based on the poll that you all were saying, which the number one thing, the symptom was the weight gain and bloating. And yeah, it's just uncomfortable. It is something that, we're trying to be in good shape and feel good, and extra weight and bloating just doesn't help. And it's nice to understand why, so that way we can try to help navigate and what we can do about it. And when it comes to birth control related weight gain and bloating, these are influenced by both hormonal effects of the contraceptions and your DNA. So how does this work? Well, when we're talking about estrogen in birth control can lead to water retention. That can cause the bloating, temporary weight gain. Yeah, it sucks. It unfortunately is one of those things, but it's a matter of how much and how your pathways are working. When we're talking about progestin, this is a synthetic progesterone. Now, granted, and please correct me if I'm wrong, Dr. Steady, that birth control, it isn't always, or doesn't always have to be estrogen and progestin, a synthetic form, does it?
There are progestin-only birth control pills as well.
Okay, so, but in progestin, okay, so let's just stick to that particular hormone. That can increase appetite. That can lead to higher caloric intake, and therefore potential fat gain, especially with the progestin-only methods like Depo-Provera shots, okay? Some people are just more sensitive to these effects, especially, when they end up experiencing those pronounced symptoms based on their genetics. If their mood and behavior is such, and genes that they have in their diet nutrition, that for particular foods, like how they may, if they eat fat, and they're more likely that when they eat fat they gain fat, or eating starches, that they don't break it down very well and it ends up shifting over to fat more readily. Well, if you're eating more of those things because you're craving more of those things, those carbohydrates, well, yeah, that's going to be a problem. So this is something that, knowing yourself, knowing how your pathways are, you can be better prepared if you are going on like Depo-Provera or one of these other birth control symptoms. Does it mean that you won't have them at all? No, but you can make a better informed decision on how you want to handle this. Was there anything you would like to add when it comes to weight gain, bloating, genetics, and what can be done?
I think that can also be impacted by the CYP3A4 gene, because because 16-OH binds more to the estrogen receptor in tissues, especially adipose tissue or fat tissue. And when it's there, it can create fat and reduces fat breakdown. So knowing your genes there, and whether you're going to want to put more estrogen into the system that's going to get broken down that way, or trying not to have it broken down that way through lifestyle modifications, would be something to keep in mind around that as well. Does that make sense?
Oh, definitely. And actually, let's ask the audience, does that make sense to you? Is this giving you good information? If that's a yes, put a 1 in the chat if what we are talking about is making sense. If it's not, put a 2, or ask more specifically what it is that you would like clarity on. And I am seeing some ones. Jody, too. If you can put in the chat, Jody, what kind of clarity or what you would like to understand better about what we are talking about. So as we are waiting for Jody to put in her question or to clarify or ask for better clarity, what other genes do you find to be most impactful when it comes to the use of birth control and possible issues that are gene related?
Well, I'm not quite done with CYP3A4 yet.
Oh, I
Actually,
apologize.
no, I was done speaking for at the time, but then I remembered other things that I wanted to say about it.
Please, yes.
So if one, um, quickly, um, metabolizes into 16-OH, then that is not going to be great for inflammation, and that can be associated with more blood clotting. All of these estrogens that go in tend to have some interaction with CYP3A4, and so in terms of blood clots, this is an important gene. But if you have a decreased metabolism into 16-OH, or you clear it really fast, the week that you take your sugar pills, you are more at risk for migraines. So like it just depends how quickly. So AA, you might be more likely to get migraines, and GG, it's not that you're going to get blood clots, but that might be something to keep in mind, and deciding which of those, depending on which of those you have, a birth control pill may be more scary or less scary to you, because you might think, oh, I can deal with a migraine, but I don't want to risk something happening to my cardiovascular system. Or migraines can be really awful. I know that from personal experience. And so knowing that that might be why it's happening, it can be really important as well.
Yeah, I dealt with migraines
Me too.
quite a bit. And actually, I'll share something personal, like I had mentioned at the top of the webinar. For myself, my hormone profile happened to be estrogen dominant with increased risk of estrogen toxicity, because I do make more of the 4-hydroxyestrone. So now, obviously, I didn't have this information when I was younger, but when I was young, I used to have very heavy periods. I used to get migraines. I mean, it was just, my cycles were very irregular. And so at that time, back in the 80s, and yes, I'm old, my doctor decided to put me on birth control to help, stabilize my periods and to help with the migraines and things like that. Well, it did help to stabilize my period, but there were other side effects. Unfortunately, it did not stop the migraines. I ended up where I had to be on Imitrex and other, migraine medication. Of course, also come to find out, there was mold in the home that I grew up in. So there's all of that, which only exacerbated the symptoms. But unfortunately, another side effect was lower limb thrombosis. And that's something that I think we should touch on as well, because when you're talking about blood clots and venous thrombosis, okay, and so for those of you who don't know what venous thromboembolism, or what that is, what it is, it's a condition where blood clots form in the veins. And typically it's the veins of the legs, okay? And what can end up happening is that it can block blood flow. It creates red, swollen, hardened, areas because of the pressure. And the thing is if part of that blood clot breaks off from that, deep venous thrombosis and travels to the lungs, that's what you call pulmonary embolism, blocking the blood flow. Okay. Again, this is very dangerous. It can be very deadly. So this is something we need to be aware of. Well, I ended up getting that. Now, thankfully, obviously it wasn't deadly and I was okay, but they didn't know. It was kind of like, oh, here, do this. And then I had the problems and then we had to adjust. But back then we didn't know anything about how DNA worked with all of that. And the same thing happened when I was pregnant. Both times I would get the lower limb thrombosis, again, because of that extreme changes of my hormones. So when I was talking about cardiac issues, that recent study in the British Medical Journal that came out earlier this year, and things that Dr. Steady was mentioning, this is real stuff, and this is something to be aware of, because again, although I had it and we were able to manage and reverse that where it wasn't an issue, it could have been. So I wanted to ask you, Dr. Steady, if you can give us some more information or something, that you have seen or studied when it comes to cardiovascular, blood clots, hormones, with blood, with birth control. Would you mind, sharing some of your insights and experience?
Well, some of it can come down to inflammation of the blood vessels. That's one of the causes of it, and it can affect things in that way. There are a few different mechanisms. The liver um, processing things and can also be a part of this. And are you wondering what people can do about it, or what's your question?
Oh, okay. Well, it was more or less genes that and have found can affect cardiovascular health in
Hmm.
relationship to someone being on birth control. And
Got
then
it.
we'll get into, hey, what can we do about it?
Okay. So if someone metabolizes things into more inflammatory types of substances, and they're not great at detoxifying, if they have a slower compt, or they have an MTHFR that doesn't work in quite the way that would be optimal, or something, or anything in the GST family, then these inflammatory substances are floating around, and they can impact other if and then depending on what your NP21 status is, um, that if you have a lot of G's, then all of your vessels from your brain to your uterus to all everywhere in your body can be impacted by that. Those things can be very sensitive to inflammation. And I think that the way that we talk about them is them being Teflon-like or not Teflon-like, where things either stick or they don't. And so those are some places that I think things can go awry depending on one's genetics. So some of the genes involved in that would be CYP1B1, CYP3A4, as I mentioned. I'm not obsessed with it, I promise. Um, and we want to have more of a CYP1A1 that strongly metabolizes estrogen into 2OH instead of not favoring that pathway. But even if it does that, if you have slower methylation, you still have to find a different way to detoxify that in phase 2 detoxification.
So one of the things that you were mentioning, okay, the 9p21 gene locus. All right. So for those of you who have your DNA 360 reports, you will find the information on that particular gene locus in your cardiovascular profile in that report. Okay. She was also mentioning about the CYP CYP 1A1, the 1B1, and the CYP3A4. You will find those genes in your hormone profile. It's hormone and fitness reports. So, as you're going through and taking a look to see, hey, what's my genotype? What am I looking at? That's where you're going to find those. So you were saying about, okay, we have some issues. If someone has a higher sensitivity to toxins in their blood because they have more Gs on their 9p21 gene locus, and the fact that, okay, they may be producing more, genetically speaking, more of their estrogen metabolites, let's say the 4-hydroxyestrone, like me, okay? Actually, I have 5 Gs on my 9p21. So this is something that I'm a perfect candidate for what you're talking about. So what do I do?
Well, managing your detoxification and your inflammation is a really great place to start. So depending on what the rest of your genetic profile is for detoxification, we would try to enhance that in any way that we can so that you can, and there are certain supplements and things like that that you can take that will push things more strongly down the 2OH pathway or convert from 4OH to 2OH. And so that's one way that we would handle that. But then just making sure that everything happens well with detox. The GST 9p21, I see a connection there, right? So we want to make sure that that family is working well with glutathione. And so if you can handle something like a liposomal glutathione, then great. If your genetics can't handle that, then we would look at precursors to that to just make sure that we are helping you to do that. And then any anti-inflammatory diet, lifestyle, supplements, things like that to try and bring down that inflammation so that your vessels can not have to deal with such a burden.
So how could that, and by the way, I think that's brilliant. Definitely supporting our genetics, making sure that our terrain is, well fortified, that everything is efficient. So that way, if and when I do bring on some exogenous hormone, that I'm better prepared for that. So I love that. But I'm wondering, for people, say they have that and they're thinking about getting on birth control. Okay, they're still cycling for whatever reason, they want to do that. Although I do want to say that the reason why they want to get on birth control can also be a source of communication, of a conversation about how to go about it, because just going straight to birth control may not be the best answer, may not, it's not something that you might want to have that be that first option. But this is where it can open up that conversation with the doctor. Because go ahead.
I was going to say it depends also why you want to use birth control. If it's, if I was put on it as a teenager to regulate my periods because they were kind of awful and it did not go well for me. If I had known then, and if my parents had known then what I know now, I'm still not sure they know. That's okay. Nothing. That's fine. It's not their job. It's my job. Then we could have done things a little bit differently. And I wouldn't have had the symptoms that I was having, and I wouldn't have had to go on birth control before I needed it for birth control, because I didn't when I was put on it for years. I didn't need it for that reason. So if someone is looking, there are other birth control options if that's the reason that someone's being put on it. But it also, I think, sometimes gets used as sort of a anything can be fixed with sort of like these 4 medications, right? Like an antidepressant or Advil or birth control, like it's sort of like there are certain things. And so when something goes wrong or it feels bad gynecologically, I think that the birth control pill a lot of times is something that is given, like the person in the chat was saying they want to put my daughter on this. What are some other ways that heavy bleeding can be controlled so that her ferritin can come back up and maybe not have to have something else added into the mix, right? So it just depends on the reason for the birth control in the first place. Does that make sense?
Oh, absolutely. I mean, just like in my case, I wasn't on it, for birth control. I wasn't sexually active at that time. It was to help regulate, to lower the migraines, to lessen, to dampen those symptoms. And like I said, if I would have known back then what I know now, oh, there's a lot that I would have changed that I know. I know would have helped. First of all, getting myself out of that mold-ridden environment, or at least, having my parents done some remediation, because like I said, that it totally exacerbated it. So looking at the environment of how can you lessen the toxic exposure that the body is having to handle, on top of, or that is, poking the bear of a genetics that is making someone have stronger symptoms during their periods. Making sure that their vitamin D is at a good level, checking that, looking at what is their current toxic load, okay, well, let's put that aside because we already talked about toxic load with mold, even though there's a lot of other things that can cause toxic loads, like estrogen mimetics. Okay, so plastics, and are you eating with plastic utensils, and in reheating things in plastic containers? And I mean, that is just pouring fuel on the fire when it comes to our endocrine system. But also looking at the genes, saying, how can I best support my patient? And this helps for Marina as an OBGYN. Okay, going, okay, here's my patient's genetics. How can I support them so that way, based on their genes, that their detox pathways are being supported as efficiently and effectively as possible? And that brings me to methylation pathway. Okay, and you've mentioned this glutathione conjugation pathway, your GST genes. Okay, are they being supported enough? It's like, work that terrain, work that foundation to make sure that is strong and resilient. Then if there needs to be birth control, because of symptoms, well then, maybe you can go lighter. Maybe there's something else, so that way you are mitigating any possible increased risks, like what I had mentioned at the top of the webinar that they found, in the study. This is really important to, first of all, mitigate exposures, any incoming toxins, but then supporting the natural detoxification pathways. I'm not talking about a detox protocol. That is different. I am talking about supporting the detoxification pathways, methylation, glutathione conjugation, antioxidation, glucuronidation, okay? And that is, a lot of that is with vitamins, with making sure you've got those basic nutrients, or having supplements in, like you were saying with the glutathione conjugation, taking glutathione if they are genetically stable enough to do that, they can handle that. If not, well, definitely the precursors, things like NAC, selenium, milk thistle, having these precursors to help support that. And also, considering now the reason of birth control for what its name is for, birth control.
May I add something just super quickly?
Absolutely, please.
That a lot of times the symptoms that have people be put on birth control in the first place could be remedied if one knew their genetics. And instead of sometimes adding fuel to the fire, balance things out between estrogen and progesterone or something like that, or just detoxify the estrogen better so that it isn't causing certain things, could prevent things like fibroids and polyps and things like that before they ever start. And that would help people for the rest of their lives. And then perimenopause wouldn't be so bad. And people's fertility would be enhanced. And so it's sort of like at the teenage years is this really beautiful time to intervene if there are symptoms happening that can carry throughout someone's life. So I just wanted to add my little 2 cents on that one.
I am so glad you did. That is such an insightful and important thing to realize and to talk about. Okay, I'm going to shift gears a little bit because I do want to answer the question that we had. Jody, she was asking about getting clarity and understanding. And so she specifically asked, what genes make you fat on estrogen? So I'd like to mention a few things here because it's not, it's like this interplay of several different things. And so some of the genes that would affect, okay, or that are more strongly associated with weight gain, especially when using birth control, estrogen-containing birth control that we have in our reports. So the FTO gene, okay, fat mass and obesity gene, it's associated with increased body weight and obesity risk when affecting or by affecting appetite regulation, energy balance, and variants of the FTO gene. So we're talking about, by the way, you will find this gene in the diet nutrition reports, okay? And it's F as in Frank, T as in Tom, O as in Oscar. The A allele is suboptimal. T allele is optimal. And so that's what you want to look for. The variants, okay, can compound weight gain effects on hormonal contraceptions or contraceptives. Another one is the MC4R gene. Again, you'll find in the diet nutrition reports. And the MC4R regulates appetite, energy homeostasis, mutations. So MC4R, you will see C as in Charlie is suboptimal, T as in Tom is optimal. Okay. And when you have mutations, those are linked to increased food intake and early onset obesity. And that can actually be exacerbated by hormonal changes in birth control. Another one would be, I would say, COMT. So the COMT gene, COMT. So this is that last player on the methylation pathway. It's what puts that methyl group onto the substrate, whether it's an estrogen metabolite, whether it's a neurotransmitter, whatever the case may be. So COMT, which one of the neurotransmitter it influences is dopamine. Okay, so for dopamine metabolism and that food reward pathway. And there are certain variants when it's fast, well, you've got the hold on, because it's a val the COMT. It's hold on, I want to make sure that I have the right, because a lot of times you'll see like val-met ones, but in our reports the G allele is fast, the A allele is slow. So in any case, the certain variants are associated with higher body mass index and increased preference for those high caloric foods, potentially amplifying weight gain, especially when you're on birth control. So I wanted to make sure, to mention those but there's also the ones for glutathione, methylation, the estrogen metabolites. All of these play roles in the way that we have inflammation, the way that we associate the information of food, our relationship to food, and the way that our hormones are fluctuating. Because I'm sure we've all been there when certain times of the months, we are ravenous when it comes to breads and pastas and chocolate. And yeah, this is part of it. It's what our body ends up craving in certain respects. So did you have anything to add to that? Or I noticed you were kind of glancing at the chat. Was there
Yes, because there was a question about the FTO gene, and so I was trying to double check my spreadsheet against what her report said, and what I have is that the A allele, you have trouble with satiety.
correct?
Her report, she said, says that the T allele does that. So I was just double checking that you and I were um, not confused, but I don't believe we are. I think that there must be a glitch in the matrix on the report. So
Okay. Yeah, I would
I,
take a look at that. Go ahead.
yeah, I was just going to say I'll check in with the people who make the reports about that.
Perfect. All right, so let's talk about um, some of the other genes or some of the other risks of birth control and our genetics. And then I definitely want to start working into some of these questions because we've got some great questions that have been put into the Q&A. So we touched on a little bit on the MTHFR. Okay, and actually there's a little bit more that I'd like to talk about that. We touched on the glutathione conjugation pathway, the genes that metabolize estrogen into the estrogen metabolites. We mentioned about the 9p21, cardiovascular endothelial lining sensitivity. Are there any others that you wanted to do a little call out? And I definitely want to mention some things about the methylation and MTHFR.
I just wanted to say that if if estrogen gets cleared down the more inflammatory pathways, that can also affect um, the brain, and that can and that then if that affects your COMT, which affects some of your neurotransmitters, then you can find yourself in a less stable feeling um, place than one might otherwise. And so seeing the link, and some people are really also sensitive to progesterone. And so noticing when in the cycle or where in your pills you're feeling better or worse, and how you feel on the placebo pills and things like that, would be it would be worth kind of jotting it down so that you and your doctor or your team can figure out what's going on for you personally.
Absolutely. And, I think it's really important. And I'm glad you had said that take notes, start educating yourself to open up that conversation, to speak with your doctor on how to set up a good treatment plan for yourself. Because remember, you are partners with your doctor. Don't give away your agency. You're smart. You know your body better than anyone. You live in it 24/7. So make sure that, that they know what you're feeling, that they respect how you are feeling and your knowledge, and bringing this to them and say, let's have a conversation about this. So I'm really glad that you had brought that up. Okay, so one of the things I wanted to dive a little bit deeper into was the MTHFR on the methylation pathway, because there has been a lot of research when it comes to methylation, birth control, and how it can affect the detoxification of estrogen. how it can affect mood and behavior. Because that's one thing that we don't want to overlook is the mental health side of this. When we consider that there was a 2016, again, Danish cohort study that they had analyzed data from over 1 million women aged 15 to 34 that found hormonal contraceptive users had a higher likelihood of being prescribed antidepressants or diagnosed with depression. You know, that risk was notably higher among adolescents and users of progestin-only pills. I mean, our young people have a hard enough time navigating technology and, you know, just going through life as it is. We don't want to be throwing more issues on top of that.
That said, they may not be ready to be parents. So there's a balance to why they're taking it and what people want for their children. Just to balance out the conversation a little bit.
Absolutely. And again, it gets down to why are they taking it? Why? You know, and there's no judgment. I'm really glad that you mentioned that. Thank you for that balance. There was another study. It's a 2017 study. Again, another Danish study. They do some really good studies on suicide risk. They had found that women using hormonal contraceptives had an increased risk of suicide attempts and suicide, particularly within the first 2 months of use. That's scary. That's sad. You know, when you have these hormonal changes and you're not prepared, or you don't have the right kind of support or understanding, oh, this can affect my neurotransmitters, how my brain is processing, my mood, my behavior. That kind of thing should not happen. Unfortunately, yes, it does, but the awareness needs to be there. Again, it's not like we want to say, hey, don't ever take this and you shouldn't be doing this. No, but be fully informed so you can weigh out your pros and cons. So when we're thinking about the MTHFR gene, okay, the methylation pathway, because MTHFR is central to the methylation pathway. It is very important for detoxifying excess estrogens, which we've talked about, which CONFT is one of, you know, part of that process. It processes synthetic folic acid, which is unfortunately common in birth control. And I will say that folic acid being synthetic, you won't find it anywhere in nature. And it actually disrupts and causes some issues with the methylation pathway. Here nor there, either way, you know, we have to deal with this. But another thing that methylation does is it regulates neurotransmitters and homocysteine. Now, when we're talking about the MTHFR enzyme, okay, and there's two different genes that we look at. By the way, you will find these two genes, the MTHFR genes, in the inflammation reports, anti-inflammatory reports. You will also see it scattered throughout your other reports because it is so ubiquitous, meaning that it affects so many different systems in the body. But MTHFR enzyme converts folate, okay, which is a form of B9, into its active form, 5-methyl tetrahydrofolate. Yes, it's a mouthful. Say that 10 times real fast. Anyway, it supports that methylation reaction. It's very critical for DNA synthesis, for neurotransmitter production, detoxification. And when there are polymorphisms, okay, when you have dysregulation or suboptimal alleles. So for the MTHFR, remember I told you that there's two. One of them has an RSID that ends in 133 or 1133, okay? And sometimes you'll see it listed as C677T. Now, what that part is, that's a nucleotide change. It just means that the C nucleotide at that position, the 677 position, gets changed to a T allele. Okay, so C is the optimal, normal wild type nucleotide. T is the suboptimal. So, and that can actually reduce enzymatic activity like 30 to 40%. If you have a TT, like me, you have like a 70 to 80% decreased enzymatic activity. All right, so keep that in mind. The other MTHFR gene, this has an RSID that ends in 1131. And this is where the A allele is optimal, the C allele is suboptimal. So, just kind of grounding you guys in what the actual nucleotides are. So when there are polymorphisms, when you have reduced enzymatic activity, that can lead to impaired folate metabolism and elevated homocysteine. When you have elevated homocysteine, you can have an increased risk of blood clots. And, this is unfortunately an issue when you start throwing birth control on top of it. It just kind of pushes that even more. So, this is where that increased risk of thrombosis, which is why, because I have, a homozygous suboptimal in my MTHFR plus some other suboptimal genes in that pathway, this is what made me so susceptible when I was on birth control, when I was pregnant, to have lower limb thrombosis. So again, the genes can really inform what is going on and how you can be careful and prevent problems from happening if you still so decide that being on birth control is in your best interest or in your family member's best interest. But getting into the mood disorders, okay, and depression, this happens because of impaired neurotransmitter synthesis, and it is worsened by hormonal fluctuations from contraception. So the MTHFR, again, when it is mutated, reduces that methylation. This impacts neurotransmitter synthesis like serotonin, dopamine, okay, which increase the susceptibility to mood disorders, particularly with these hormonal changes from contraceptives. And, when you start getting into poor folate utilization, that can affect fertility or increased risks, or increase risks if pregnancy occurs after discontinuation. A lot of these things you need to be aware of, because problems with the MTHFR can further impair, with it impairing folate metabolism, and it can increase the risk for neural tube defects and pregnancy complications. So, especially if that contraception occurs soon after starting the pill. So this knowledge really can open up that conversation, speaking to your OBGYN. And this is why I am so happy that we have one in-house listening, because I'm sure she's got a lot of information, and, this is just enhancing that information for her in her practice to have these conversations. So I think that, the realization of where we need to support major pathways like the methylation pathway should be done regardless of whether you're on birth control. So do you have any final thoughts on that before we jump over to answering all of our beautiful, wonderful questions from our audience?
I don't think so. I think you covered it beautifully.
All right. So may I ask you the honor to jump in and start answering some of the questions?
Sure. I definitely have something to say about the second question. Do you have anything to say about the first question?
Actually, I'm going to let you jump in and answer the second question,
Okay.
Jody.
So we have a question. How does all of this info apply to BHRT? So it's different in some ways and the same in other ways. So it's different in that BHRT is bioidentical. So it is more like your own hormones than some of the synthetic things that are used in birth control pills. You're also adding it at a time when it's decreased naturally. When we're put on BHRT, it's because our own hormone levels are dropping. It's not adding more on to a system that has quote unquote enough, right? That said, it's also going to get metabolized by the same pathways as the birth control pill and your own hormones that you've always had. And so paying attention to those pathways is important on BHRT because you want to make sure that you're detoxifying through the correct, you're metabolizing and detoxifying in the way that is most optimal for your body. So knowing your genetics helps you at all stages of life.
Thank you for that. And I was reading the first question from Lydia, and honestly, what a great question. I mean, nowadays, let me read the question so people aren't going, what is she talking about? So Lydia said, I ran out of eggs 2 years ago. I learned from energy psychology practitioners that some people regrow organs, and I want to regrow my eggs and other cutout parts. Any suggestions? Okay, so there, our liver actually can regenerate. Okay, that's an organ that can. Unfortunately, with current scientific evidence, we don't have natural regrowth of eggs or entire reproductive organs. Really interesting thing though, because I had done some advanced research training at marine biological laboratories in Woods Hole for stem cells and regeneration. And we actually studied and worked on different species that do regrow organs, limbs, axolotls being one of them, planarias being another. Really amazing. And the basis of this research is how can we leverage how these animals regrow body parts and regrow themselves. Like with planaria, you could cut them up into 100 pieces and they'll grow to have 100 more planaria. I mean, it's absolutely amazing. How do we leverage that? How do we learn from that? We're getting there, but not quite yet. And with research of 3D parts being made, these 3D printers and other organs that you can decellularize, which I actually did some work on, of hearts taken from other animals like porcine, pig, decellularizing it and putting new cells in it and then, putting it into a person. This is research, this is work that is being done. But for us to de novo grow, and what I mean by that is from new, just all by itself without extra help. There's nothing in science or knowledge, or we just don't do that. Although it's, again, never say never, because I I don't know everything, but as of right now, no, we can't. But I love the thought. I love the idea. The best thing I would say is that you can just support your body, your overall reproduction, hormone health with things that, we have been talking about. So anyway, I love where that's going into that more futuristic or, who knows what can happen type of thing. So I appreciate the question. Thank you, Lydia. All right, our next question is from Jana. She says, I have ER positive breast cancer. I'm interested in how my genetics affect the choice of aromatase inhibitor. Will this webinar touch on any of that by any chance? I do have my genetics done through 23andMe and GeneRx, but my naturopath is referring me to the DNA company. I will say that we have done some breast cancer and hormone webinars, and we are actually going to be doing a breast cancer summit, which I think would be wonderful for you to participate in. This particular webinar, we are sticking more with birth control, the genetics of that, symptoms due to that. Breast cancer is stepping outside of that main topic, but if Vanny or Katie, if you can put in the link or a link for more information to our breast cancer She Summit, that will be coming up in, I believe, October. Yes, that would be fantastic. All right. So our next question, actually next two questions, are from Dee. And would you like to do this one?
Sure. Dee says, my daughter was on birth control to manage PCOS. She switched her first prescription because it affected her mental health, and then switched again, but had side effects. Now, after being on another birth control script for 2 years, she stopped taking them, hoping PCOS symptoms don't progress. Any suggestions on how to manage PCOS? And I have a lot to say about PCOS. And actually, we did do a webinar on PCOS and endometriosis that you can look in the app for past webinars, and we have one on there. But also, I would be delighted to try and help if your daughter has her genes and you want to make an appointment, because it's complicated, because it involves a bunch of different things and how they interact. But I do have a lot of things to say about PCOS in general. So. Oh, and is it okay for her to stop abruptly taking birth control, or does she have to taper off gradually with birth control? I don't know what dosage she's on, so that would be a question for her prescribing physician. I can't tell anyone to stop taking their medications against the advice of their prescribing physician. I wouldn't do that. So that would be definitely a question for that provider.
Thank you. All right, let's clear those. And all right, Shelly. Shelly's saying, the reason I'm interested, I'm not sure what what you were initially referencing to, but she says that her daughter's pediatric neurologist suggested that her daughter see a pediatric gynecologist to help with hormone control, because he thinks my daughter's epilepsy is connected to her hormones. I'm thinking the gynecologist will prescribe birth control for her to stabilize her hormones. I'm not seeing a question in there. If you do have a question specifically, you can pop it in the chat, or maybe put it in the question and answer. So do you want to take Mickey's question?
Sure. Could bloating and weight gain also be due to faster CYP1B1 and suboptimal antioxidant capacity and detox of estrogen? If one is a slow aromatizer and not used to high levels of estrogen, wouldn't adding more hormones cause a flood of hormone that one's biochemistry may not be used to? Would this also apply to BHRT? How could one mitigate the risk of heart disease without taking BHRT, especially if one took birth control at an earlier age and has a high risk for breast cancer? That is like 6 questions. Okay. So I have to go back to the beginning. Could bloating and weight gain also be due to faster CYP1B1? Faster CYP1B1. I'm not sure that a faster CYP1B1. What do you have thoughts on that, Dr. Varden? I'm not seeing that as necessarily
because
direct.
a faster CYP1B1 just genetically produces more of the 4-hydroxyestrone metabolite. And I don't see that being a direct cause to weight gain. Inflammation, yeah.
Yeah, that's more associated with inflammation.
Which may be down that proverbial line yeah, increased inflammation could, but I mean, as a direct, I would say probably not. Um, but then again, you know,
But
I want
yeah.
to mention that just because you may genetically produce more of a particular estrogen metabolite doesn't mean you actually are. This is where testing has to come into play, whether it be a Dutch test, whether it be blood work that actually looks at the estrogen metabolites, the amount of which you are actually creating. Because say you are eating a lot of cruciferous vegetables, maybe you're on supplements, calcium D-glucarate or DIM or I3C or something like this. Well, you can be affecting the actual metabolism. You know, like I said, I make more of the 4-hydroxyestrone, but I also eat a lot of cruciferous vegetables. I do take calcium D-glucarate. I do these things. So in my actual Dutch test, and this, my percentages are fine. I don't have to worry. I have mitigated that risk of estrogen toxicity. So there's different factors at play that you need to be mindful about. You looked like you had something else to say.
Well, I was just going to say yes to all of that, but also I guess that in theory, higher inflammation can affect things like insulin resistance and cortisol and things like that. So like indirectly, I just was trying to think through the question to its end,
Right.
whether or not that's helpful or I don't know, but and the same with the suboptimal antioxidant capacity. That would be once again that's how the inflammation could play into it. If one is a slow aromatizer and not used to high levels of estrogen, wouldn't adding more hormones cause a flood of hormones that one's biochemistry? I mean, it would certainly take adjustment, for sure. Um, and that can be where, in some of those studies, the first 2 months was the biggest risk period for some of the side effects. And that could be where some of that shows up, right? Would this also apply to BHRT? Once again, with BHRT, you've been at a deficit and now you're adding something. So it's a little bit different, but you still are processing all of the hormones in the same way. How could one mitigate risk of heart disease without taking BHRT? I mean, looking at the rest of your genetics, trying to optimize them, making sure you're detoxing, making sure your inflammation's low, making sure you're not over-exercising or under-exercising, just optimizing your whole system and thinking of yourself holistically. Especially if one took birth control at an earlier age and has a high risk for breast cancer, just once again, trying to optimize everything as best you can would be my answer. Oh, the second.
Yeah,
Go ahead.
because they have a continuing question. The next one down, that the study also considered genes that influence cardiovascular disease. Okay.
For example,
those with higher cardiovascular risk due to variants in ApoE, 9p21, or PCSK9.
Well, and I guess that's part of having it all be in one country is we don't know how similar or different. I don't know the details of that. But genetics should be considered in all of those things because they can certainly influence the outcome 100%.
And the studies that I was talking about, they actually had done more focus on the methylation pathway. When I was reading through the studies, they didn't talk about 9p21 gene locus. They didn't mention, some of these other genes. So again, it's hard to tell. It's understanding that every research study has its limitations. So, and we can just base it on the information that's being provided, but methylation is a major pathway that can affect cardiovascular health. Lydia has a question. What are the other options for BCP for a young girl who needs birth control but does not want to go on BCP?
What are other options for birth control? I think for a younger who needs birth control but does not want to. That's okay. So that it was the second P that kind of threw me off. The first P, I mean. So There are definitely, well, there are non-hormonal IUDs if the hormones are the reason that they don't want to go on it. There are barrier methods like condoms, diaphragms, and cervical caps, spermicides, sponges, and um, I mean, obviously, they don't want a permanent option at that age. Um, there are also hormonal IUDs, but I don't know if the reason is for not wanting to go on the birth control pill is not wanting to remember to take it every day, which can be really hard for young people, I think. In which case there are injections and implants and hormonal IUDs, or if it's wanting to avoid the hormones, in which case the barrier methods or spermicides are the other options that I can think of. Do you have anything to add to that, Dr. Varden?
Um, well, uh,
I think for a young girl, biorhythms or
yeah,
withdrawal is not a little too difficult, right?
yeah, because I mean, that's what's kind of going through my mind. But the best protocol or way of doing it is what's actually going to be followed. I mean,
Yeah.
abstinence is surefire way, but um,
I don't know
that
how realistic that is.
exactly. Yeah. So again, it's researching the options and seeing what is the most realistic, reasonable, something that she will be compliant with. So, but great information. Thank you, Dr. Steady. Jody is asking, what's the best way to detox estrogen better? And I've already mentioned some. There's a lot of different ways. So when we're talking about detoxifying estrogen, this involves supporting both your phase 1 and your phase 2 liver detoxification. You want to optimize like gut methylation pathways. You want to reduce any exogenous estrogen exposures, like what I was talking about earlier in plastics, in different types of compounds, toxins that are in beauty products, and a lot of these things that are estrogen mimetics or endocrine disruptors. So, you again mitigate those exposures. But let's get back to supporting liver detoxification. So your phase 1. Okay, so phase 1 is the hydroxylation. This is part of the CYP P450 family of enzymes. So where you have the CYP, cytochrome P450, and so this would be like what I had mentioned, the cruciferous vegetables, like broccoli, kale, Brussels sprouts, things like that. Rich in I3C, indole 3 carbinol, and sulforaphane. This favors the 2-hydroxyestrogen metabolism, that protective path that Dr. Steady was talking about earlier. DIM, diindolylmethane. This enhances that CYP1A2 gene activity to produce those safer estrogen metabolites. Avoiding things like alcohol, acetaminophen, these burden the liver, slow detox. When we're talking about the phase 2 detoxification pathway, the conjugation pathways, methylation, glucuronidation, sulfation, things like that, you want to support with the vitamins, the cofactors that support and are necessary in these pathways. So for like methylation, your B vitamins. Okay, things like betaine, trimethylglycine, SAMe. Okay, now I'm not saying that, oh, you should just be taking all of these. No, this is in literature. This is showing that these are the types of things. Which one you should take, that is something that you and your provider need to discuss to see, is this best for you? Not just using your DNA as a basis, but also what is the rest of your life look like, your history, your environment, all of these different things. It's important. I had mentioned like calcium D-glucarate that helps to support glucuronidation, NAC, glutathione, for your sulfur support. Okay. But another thing, optimize your gut health, daily bowel movements. Okay.
You took the
Estrogen,
words right out of my mouth.
yeah. Estrogen is excreted via the bile. Constipation leads to estrogen reabsorption. Guys, you got to be pooping. Okay, get that shit out, literally. All right, you want fiber-rich diet, probiotics, you want to modulate the estrobolome, the gut bacteria that metabolize estrogen. All right, eliminate the processed foods, reduce that estrogen load. And, again, tailor for your genes. Know what your genes are saying. So I think that pretty much covers it. Well, at least most of it. Let's get to our other questions. Let's see. Shelly, it might help to share that my daughter. Oh, okay. She was just making a comment. Okay, sorry. Let's see. How about Lydia also is asking, could there be a relationship with the onset of schizophrenia and hormones and dopamine in a young female entering puberty? Do you have any thoughts or information on that, Dr. Steady?
I look at the body as one thing that where most things interact with each other. And so I'm not saying that it would be causal, but there could be a relationship there depending on the timing of everything. So it would certainly be a good thing to look at in managing that, but I would not say any one thing is a cause like that. Do you know what I mean?
Yeah. For Nina. Hi, Nina. So glad you're here. So nice to see you. Oh, well, have you be here. Okay, so Nina is asking, could red light therapy manage birth control complications like thrombosis? She's saying, that we were talking about its effectiveness on blood flow and circulation in previous webinars. Also, could it help with depression since red light therapy activation or activates and enumerates serotonin receptors through cytochrome C oxidase and ATP? And she's saying, is this relevant to pain relief also during the period or during, a woman's cycle? So, and that excellent questions. And yeah, red light therapy does hold a lot of promise for supporting some of these complications that are associated with hormonal birth control, particularly in areas like blood flow, mood regulation, pain relief, although it's not necessarily a direct treatment for thrombosis. It can definitely assist, kind of like behind the scenes, because it really helps with energy of the cell, mitochondrial health, its efficiency in helping with mitogenesis, in its efficacy in doing its job. And if we don't have the energy to clear things, to do the jobs that the cells, the tissues need to do, then it's not going to happen. So anything we can do to help support the mitochondria and cellular health, it's excellent. Now, when I was mentioning about thrombosis, again, it's not a direct treatment, and red light therapy, although it can help, like what I've already talked about, it's not a substitute for anticoagulation or clinical management. So, really that is something that, working with your provider, with the doctor, would need to be discussed because of the higher risk of thrombosis, the blood clots, okay? That does need to be addressed. Again, addressed by your doctor based on the history and the knowledge that they have on your case. So, but great questions. Thank you so much. And we've got time for our last question here. And I know that there were some others in the chat, but seeing that we've got 2 more minutes, we've got one nice question, our last one from Sandy, which I'm going to kick over to you, but I'll read it if you want. She says, I am in perimenopause and trying to get off low dose birth control. And she tells what's in that she's been on for 30 plus years, but have had terrible side effects between 6 to 8 weeks of trying to stop it. So she ends up starting it again. She'd love to have hormone testing, but obviously need to be off the birth control first. Any general recommendations for helping my body handle coming off of it? As a question, she said she has poor detox genes. She's co-dominant, meaning that her genetic hormone profile is co-dominant, meaning estrogen and androgen dominance. And that she would being on something like Biest after stopping the birth control help reduce the symptoms, like, you know, hot flashes, headaches, mood changes, etc. Without giving medical advice specifically, because we can't do that, do you have some general information or guidance that could inform her to be able to have a better conversation with her prescribing doctor?
I'm going to handle the second set of second question first, with some being on something like Biest after stopping the birth control help reduce the symptoms, and that's, you know, that's what Biest is for. I'm not saying specifically for you, but it is for symptoms like that. That said, typically, people who still have a uterus, if they're going to take estrogen, should also take progesterone in order to protect their uterus. And then going back to recommendations for helping your body handle coming off, I don't know the specifics of what the side effects were after 6 to 8 weeks of trying to stop it. But if it's those hormonal ones that you listed later on in the question, then without seeing all of your genes together and all of the things, it would be impossible for me to say, just from saying I have poor detox genes, what you should do. But there are things that can be done to help, but those can also be symptoms of low hormones. And so is it a detox problem or is it a low hormone problem? That's a more complicated conversation to have.
Thank you for that. And Sandy, we hope that that at least gave you a little bit of insight or a starting point to start looking in and investigating more for yourself, and, you know, bringing this to your doctor so you can, again, have a more informed conversation with them, because I couldn't imagine the frustration and, you know, what you're going through. So definitely you have my sympathies, and I wish you the best in moving forward in navigating that. So, and I would like to thank you, Dr. Steady. It's just absolutely amazing. I love working with you. Your experience, your knowledge, your brilliance, you're fantastic. And I really enjoy this. I'm sure that our audience has gotten a lot from what you have pro-offered this evening, and will continue to do so. So thank you very much.
Thank you, Dr. Varden. You know I love working with you, and you're just the best. So thank you.
And I want to say thank you, all of you who joined us today for this webinar. We're here for you. We want to give you the information that you're asking for. You know, this is why we're here, educators at heart. And we want to make sure that we are serving you. So please, you know, let us know if there's anything that you are interested in hearing about, if there's a particular subject or an area that you would like to dive more deeply into. Please let us know. If you're watching this as a recording, throw it in the responses in the chat area of oh gosh, I don't do social media very well. In the
Try
comments.
Instagram, Dr. Varden.
There you go. Perfect. And Instagram. Gosh, I love you guys. Thank you, Tracy, our CEO. Again,
You're welcome.
We are here for you, and we appreciate you taking your time. So with that, I want to say have a beautiful evening, and also to Vanny, to Katie, thank you for all of your work. We truly appreciate you. We wouldn't be able to do all this if it weren't for you. So thank you again. Have a wonderful night, and we will see you at our next webinar. Take care.
Thanks, everybody. Have a great 4th of July weekend.